Welcome to our WHRIA talk. This one is one of two talks on bone health. So initially we'll start and spend the first 10 minutes talking about how to maintain healthy bones, and then we'll go on to talking about prevention and treatment of osteoporosis. So my name is Amanda Beech. I'm one of the endocrinologists here at WHRIA, and I have a particular interest in osteoporosis, both as a women's health condition, but also from an endocrine perspective. So osteoporosis itself is a really common condition. Over 1 million Australians are affected, which is more than breast cancer and ovarian cancer put together. And that means that 1 in 4 women over 75 are affected by this medical condition. Literally, osteoporosis means porous bones, but to you and I, that means that the bones become thinner and weaker and more fragile as we age. This means that any minor trauma can result in a fracture. And by minor trauma, I mean simply slipping off a chair or falling out of bed, or even tripping over and falling on the pavement whilst you're walking. A lot of my patients tell me that they are surprised that they've fractured a bone, that the force with which they fell, they would never have expected to normally break one of the bones that they did. Now, there are a number of sites of bone breakage or fracture that we would tend to see in osteoporosis. Primarily the wrist, so we call it the distal radius, or one of the vertebrae in the spine, or of course the one we worry about the most, the hip fracture. Now, you can, I'm sure, understand that if we break any bone, this can really affect our quality of life and our independence, but also can lead to worsening pain and disability, and even in the setting of hip fracture, early death. Now, what are the causes of osteoporosis? Well, primarily we start off with aging. So most women, as they go through the menopause, lose the very important effect of estrogen on their bones. This is the primary cause for worsening osteoporosis. In men, we know that their testosterone levels decline over time, and this can be part and parcel of why men get osteoporosis a little bit later in life. There's also a family history which is profoundly important. So the history of mom or dad having a fracture, in particular a hip fracture, or being treated for osteoporosis is really important. Of course, there are some medical conditions that will do it. So if you have diabetes, thyroid or parathyroid disease, this can worsen osteoporosis, as can a history of rheumatoid arthritis or a history of anorexia. Sometimes it's even the things doctors do to you. So various treatments for different medical conditions can actually result in osteoporosis. Things like corticosteroids, anti-epileptic drugs, and some older antidepressants can also contribute. But from the perspective of what you can do to reduce your risk, we always recommend smoking cessation, as we know that smoking itself can lead to a worsening of osteoporosis, and drinking alcohol within the recommended daily limits. Now, when we talk about maintaining bone health, what we often need to consider are 3 main things. We need to consider vitamin D, we need to consider calcium, and we need to consider exercise. So let's start with vitamin D. Now, that's a really important molecule, as it's primarily involved in the uptake of calcium from the gut. It helps us to absorb calcium and maintain the blood levels of calcium in the body. A vitamin D deficiency actually can give rise to osteoporosis, but it can also give rise to bone and joint pain and contribute to worsening falls in the elderly. We get vitamin D primarily from the sun. It's the UVB rays in sunshine that are converted in our skin and form the vitamin D. And so how much vitamin D we have depends very much on the seasons, it depends on how much time we spend in the sun, and it depends on the skin type that we have. Now we know that sunshine exposure can also lead to skin cancer, so it's very important that we follow the Cancer Council of Australia's recommendations on sun exposure and the importance of sunscreen. Some of my patients ask me whether or not they can get enough vitamin D in their diet. Well, sadly, not in this case. We know that there are some things that give us vitamin D in the diet, things like egg yolks or oily fish, liver and fortified cereals. But on the whole, we need the sunlight exposure to get the recommended daily amount. There are a number of people who would be predisposed to being deficient for vitamin D, primarily people who are institutionalized or spend most of their time indoors, be it for work or for health reasons, individuals who need to be covered from a religious or a cultural perspective, and pregnant and breastfeeding women. And it's in this population that we should look for vitamin D deficiency, and if we find it, that is a vitamin D level less than 50 nanomoles, that's the point at which we need to consider supplementation. And this can occur with a tablet or with a spray or drops. So that's vitamin D. What about calcium? Well, calcium is also really important as it forms the hard substance of bone, and it's what gives the bone its strength and its structure. Interestingly, 99% of calcium is actually present in the bones, with only 1% in the rest of the body. And it's that calcium in the rest of the body that's responsible for the activity of muscles and nerves. So things like your heart contracting is directly linked to the amount of calcium that's present in your body. So if there's not enough calcium to perform all these really important daily activities, that calcium is taken from the bone and it can cause a worsening in your bone density. Now, calcium can and should be primarily obtained from the diet. So we recommend between 1,000 and 1,300 milligrams of calcium in the diet every day, and that can be obtained primarily from milk and yogurt and cheese, but also from fish like salmon and canned sardines. Things like mussels and oysters also have good amounts of calcium in them. Some green leafy vegetables, in particular kale and Chinese cabbage, and also some nuts such as Brazil nuts and almonds. If we're unable to get sufficient dietary intake of calcium, we can also use a supplement. However, this really should be done in conjunction with a discussion with your GP or your endocrinologist. Now on to the last way we can maintain bone health, well, that is through exercise. Now, exercise is essential to maintain muscle strength and to maintain balance. What we need is to have a push and a pull, a stretch and a strain on the bone when we do our exercise. So simply going for a swim isn't necessarily going to be useful for those bones. From a strength perspective, it needs to be a body weight bearing exercise. So something like jogging or aerobics, stair climbing or tennis. From a resistance exercise perspective, that's anything that uses some little weights. So we could use wrist weights or ankle weights, or you could use weights that you get at the gym. But the most important thing here is to start slow and slowly build up, because you don't want to injure yourself by trying the heavy weights too quickly. Obviously, along with strength and resistance exercise comes the very important balance training. I'm sure you can understand that if someone's a little wobbly or what we would call off legs, they are more likely to fall. And if you fall, you're more likely to fracture. So balance training is one of those very, very important parts of maintaining health to keep your bones well. Exercises that we might recommend in that setting would be things like Tai Chi, or what I call the flamingo, where you stand on one leg, up on your tiptoes and walking sideways or backwards. These are all ways in which we really can help to stabilize the body and reduce the risk of falls. So hopefully what we've shown you in this first of the two-part series is that there are a number of environmental things that we can do using calcium, using vitamin D, and maintaining exercise that can help you to keep your bones healthy and strong. Thank you.